So there are different positions that your baby can get into in your pregnancy. So ideally, an optimal position is for your baby to be like this. So the baby's back is towards your left-hand side. And that's because when you look at the shape of your uterus is actually much more curved on the left-hand side than on the right-hand side where your uterus is steeper. So what that would mean if your baby's back was on the right is that when your baby is sitting in your pelvis, the head will be a little bit with their chin off their chest. And so when the baby is coming through your pelvis, a slightly wider diameter of their head is going to present into your pelvis. And this is about 13 centimetres. When our babies are going back into our pelvis with the back on the left-hand side, because it's more curved, they really curl up into a ball, they tuck their chin down onto their chest, and this part of their head will come through your pelvis. And that's about 11 centimetres in diameter, so much smaller, ideally what you want to come through. The other positions that they could come down in is in a back-to-back position. And that basically means that your baby's back is towards your back. And again, this just means that that wider diameter presents into the pelvis, and this can make your labour a little bit longer. So we often find with back-to-back babies that your early labour might be a little bit longer than if your baby was coming down in this position. Another really classic sign is that your contractions do something called coupling. So they'll come together. So you'll have one contraction and then two contractions and then a bit of a break. And then the same thing will happen again and then another break. Or maybe your contractions start to get quite close together and then they start to space out again. So just as you're thinking about going into hospital, they start to really slow down. That can also be an indication that your baby is in a back-to-back position, and then definitely thinking about what position you're in to enable baby to turn a little bit better. The other position that your baby can be in is something called breech. And this means that your baby is coming down, either presenting with its bum, or maybe one leg, or two legs, or they're doing a bit of the splits like this, and this would be a breech position, so the head is not coming down first. Now if you have a breech baby, again talk to your care provider about what their policies are. Most doctors will offer an elective cesarean at about 38 to 39 weeks pregnant for a breech baby. But some doctors will do a vaginal breech birth, and it's definitely worth having a conversation with them about all of the risks involved for both when you have a breech baby. If you do have a breech baby and you're hoping to have a natural birth, then you'll be offered something called an ECV at 37 weeks or more. An ECV means that the doctor will manually try to rotate your baby into a head down position in your pregnancy through your tummy. So you'll be brought into hospital, you'll have an injection to help relax your uterus, and then the doctor will then put some pressure on your bump to basically try and rotate your baby into a head down position. Now once baby is head down and they've rotated it, if they can, there's about a 50% chance that baby will stay head down, and 50% chance that the baby flips right back into a breech position again. And so your doctor will let you know what happens, you'll be scanned to make sure that they can check the position, and then you'll be talked to about your delivery options once they know what's happened with the ECV.